Most people assume that feeling more tired, getting winded more easily, and recovering more slowly from physical effort are simply part of getting older. They are not, or rather, they do not have to be. Some cardiovascular aging is inevitable, but some of what we call normal aging is actually accelerated aging, the heart and vessels deteriorating faster than biology requires, driven by factors that are measurable, identifiable, and in many cases, reversible. The difference between the two matters enormously, because if you know which signs indicate accelerated cardiovascular aging, you can act on them. And acting on them, even at 65 or 70, can meaningfully slow the process. My name is Dr. Emmanuel Osei. I'm a cardiovascular surgeon with over 2 decades in the operating room. And today I'm going to show you 5 signs that your heart may be aging faster than it should, and exactly what to do about each one. Stay with me. The first sign is getting winded climbing one flight of stairs. Let me be specific. I am not talking about being slightly out of breath after running up 3 flights. I am talking about noticeable breathlessness, enough to make you slow down or stop after climbing a single flight of 10 to 15 stairs at a moderate pace. This is a functional test you can perform right now. And if you find yourself significantly breathless after one flight, that is cardiovascular information worth taking seriously. In a well-conditioned heart, one flight of stairs produces a manageable increase in demand. The heart rate rises appropriately, the lungs respond, and within 30 to 60 seconds of stopping at the top, breathing returns to normal. In a heart that is aging faster than it should, due to uncontrolled blood pressure, arterial stiffness, early cardiac remodeling, or reduced cardiac output, even modest exertion produces a disproportionate demand that the heart struggles to meet. What to do? If you are significantly breathless after one flight of stairs, mention it specifically to your doctor at your next visit. Ask for an echocardiogram to assess your cardiac function and a 6-minute walk test, a standardized measure of functional cardiovascular capacity. Do not dismiss this as just getting older. It is a measurable signal. The second sign is slow heart rate recovery after mild exertion. After you finish climbing those stairs, or after a brisk 5-minute walk, how long does it take for your breathing to return to completely normal? In a cardiovascularly healthy adult, heart rate and breathing recover within 60 to 90 seconds of stopping mild activity. In someone with accelerated cardiovascular aging, that recovery takes 3, 4, or 5 minutes. Heart rate recovery speed is regulated by the parasympathetic nervous system, the same system that controls your rest and recovery state. A cardiovascular system under chronic strain, from hypertension, inflammation, oxidative stress, poor sleep, has a weakened parasympathetic response. The heart takes longer to downshift after demand. Studies have consistently shown that slow heart rate recovery after moderate exercise is an independent predictor of cardiovascular mortality. It is a simple measurement, it is highly informative, and it is almost never discussed in a routine appointment. What to do? Time your heart rate recovery during your next walk. Count your pulse for 15 seconds immediately after stopping, and again 90 seconds later. If your rate has not dropped by at least 12 beats per minute in 90 seconds, mention this to your doctor and ask for a formal stress test. The third sign is chronically cold hands and feet. Persistent cold extremities, particularly when the rest of the body is warm, can indicate reduced peripheral circulation. Blood is not reaching the extremities efficiently. This may be due to arterial narrowing, reduced cardiac output, or autonomic dysfunction, all of which are associated with accelerated cardiovascular aging. The key distinction is between cold hands and feet that occur in cold environments, normal, and cold hands and feet that persist in comfortable temperatures, particularly in one limb more than the other, or accompanied by color changes. Unilateral coldness, one hand or foot significantly colder than the other, warrants prompt medical attention. It can indicate a localized arterial obstruction that requires evaluation. Bilateral chronic coldness in older adults, while less acutely dangerous, is worth discussing with your doctor as part of a comprehensive cardiovascular assessment. What to do? If your hands and feet are chronically cold in comfortable temperatures, ask your doctor about an ankle brachial index measurement, a simple, non-invasive test that compares blood pressure in the arm to blood pressure in the ankle to assess peripheral arterial circulation. If there is a significant discrepancy, further evaluation is warranted. The fourth sign is persistent fatigue after a full night of sleep. This is different from ordinary tiredness. I am describing the consistent experience of waking after 7 or 8 hours of sleep and not feeling rested. Feeling as though the sleep did not restore you, dragging through the morning regardless of how much time was spent in bed. This pattern has multiple potential causes: thyroid dysfunction, anemia, depression, sleep disorders. But it is also a recognized sign of reduced cardiac output and cardiovascular strain. When the heart is working harder than it should just to maintain normal resting circulation, due to increased afterload from arterial stiffness, due to early heart failure, due to chronic nocturnal hypertension, the body does not recover normally during sleep. The cellular repair processes that depend on adequate circulation and oxygenation are impaired. The person feels unrefreshed regardless of sleep duration, because the sleep, while adequate in hours, was not restorative in function. What to do? If you consistently wake unrefreshed despite adequate sleep, do not accept this as normal aging without a medical evaluation. Ask your doctor for thyroid function tests, a complete blood count, and a discussion of your cardiac function. Sleep study to rule out sleep apnea is also appropriate. These conditions are treatable. Accepting them as aging without investigation is not the right answer. The fifth sign is blood pressure that varies widely from day to day. Most people focus on their average blood pressure reading, but blood pressure variability, how much your readings fluctuate from one measurement to the next, is increasingly recognized as an independent cardiovascular risk factor. A person whose blood pressure varies by 20 to 30 points systolic between measurements taken at the same time of day on different days has a different risk profile than a person with a stable reading, even if the average is similar. High blood pressure variability indicates that the arterial system is not regulating pressure consistently. It reflects reduced baroreceptor sensitivity, the feedback mechanism that normally keeps pressure in a stable range, and is associated with increased risk of stroke and cardiovascular events, independent of average blood pressure. Wide day-to-day variability is also a marker of accelerated vascular aging. The blood vessels have lost the regulatory precision that younger, healthier arteries maintain. What to do? Keep a blood pressure log for 4 weeks. Same time each morning, same conditions. Calculate the difference between your highest and lowest readings. If that range exceeds 20 points systolic on average, bring the log to your doctor and ask specifically about blood pressure variability as a cardiovascular risk factor. This is a conversation that is rarely initiated by the physician. You will need to start it. I want to tell you about a man I'll call Victor, 71 years old. He came to me not because of any dramatic symptom, but because he had been tracking his data. He had noticed over 6 months that his morning blood pressure readings varied from 118 systolic on some days to 152 on others, with no obvious explanation. He had also noticed that climbing to his second-floor home office left him noticeably breathless. Neither symptom was alarming in isolation. Together, with the variability data he had collected, they told a coherent story. His echocardiogram showed early left ventricular hypertrophy, the beginning of the cardiac remodeling that results from years of pressure overload. His blood pressure management was optimized. His statin was reviewed. Evening alcohol, which he drank regularly, was eliminated. 6 months later, his variability had reduced significantly. His breathlessness on stairs had improved. The echocardiogram changes had not progressed. He told me, "I came in because of a spreadsheet. The spreadsheet saved me from a much worse conversation later." Data, attention, asking the question. That is the difference between catching accelerated aging early, when it is reversible, and discovering it after irreversible damage has occurred. Let me bring this together. 1. Significant breathlessness after one flight of stairs. Ask for an echocardiogram and a 6-minute walk test. 2. Slow heart rate recovery after mild exertion. Time your recovery and ask for a formal stress test if recovery exceeds 90 seconds. 3. Chronically cold hands or feet in comfortable temperatures. Ask for an ankle brachial index measurement. 4. Persistent fatigue despite adequate sleep. Ask for thyroid, blood count, cardiac function, and sleep apnea evaluation. 5. Wide blood pressure variability day to day. Keep a log, calculate the range, bring it to your doctor and ask specifically about variability as a risk factor. These are measurable signs. You do not need a medical degree to notice them. You need attention and the willingness to ask the question. I want to hear from you. Which of these 5 signs have you noticed and dismissed as just getting older? Tell me in the comments. I read every single one. If this video gave you something useful, share it. For someone in your life who is accepting cardiovascular aging that does not have to be inevitable, send this to them. Everything I've shared today is based on current cardiovascular research and my clinical experience as a cardiovascular surgeon. This is general information, not personal medical advice. Always consult your doctor before making any decisions about your health. Take care of your heart. It has been working for you every single minute of your life without ever asking for anything in return.